and the patients trusted Planned Parenthood to make decisions on the patient's care based on the best medical interest of the patient. Instead, secretly, Planned Parenthood changed the way they treated their patients in order to get marketable body parts.
And then at the PPLA time, so go to PPLA time, with that fetal tissue procurement, would the surgeon in any way change the abortion procedure for those patients who had consented to donate fetal tissue?
Objection, vague, calls for speculation. You can answer.
Not the procedure.
Okay. And when you say not the procedure, would the surgeon change anything besides the procedure for those patients who had agreed to provide fetal tissue?
Not the procedure, which is the abortion, not the method, which is aspiration abortion. The techniques, sometimes there was a just lively discussion about whether it was permitted or not permitted to change the technique. And we were still debating that in Los Angeles when I left, but by the time I met Mr. DeLayden and his associates, I had evolved in my thinking to think that changing the technique to get better tissue was allowed.
Okay. So, and I want to make sure we unpack that so we're all clear. So when you say the procedure, because you said three things: procedure, method, technique.
Right.
Would you describe for us what is your understanding of the meaning of the word procedure?
In abortion.
If our usual technique is suction at 10 to 12 weeks, and we switch to using an iPad or something with less suction or increase the odds that will come out as an intact specimen, then we're kind of violating the protocol that says to the patient, we're not doing anything different than our care do. And to me, that's a kind of a specious little argument, and I wouldn't object to asking Ian, who's our surgeon who does the cases, to use an iPass like that gestation leg in order to increase the odds that he was going to get an intact specimen. But I do need to throw it out there as a concern, because the patient is signing something and we're signing something saying we're not changing anything in the way we're managing you just because we agreed to give tissue.
You had said that your thinking had evolved on changes in techniques. If you could tell me, when did your thinking begin to evolve on changing of techniques that you referenced earlier?
Sometime, evolution is a process, as we know. I would say that when I was at PPLA, there was question marks about whether it was permissible to obtain tissue by using different techniques, because the legal regulations were not at all clear, and nor did they define things. By the time I was at PB Pasadena, many of us were moving in the direction of making this distinction between method and procedure and a method and technique. And so I was very comfortable at that time that the difference in technique doing a different technique, say aspiration versus manual aspiration versus electronic aspiration, did not really affect the procedure or the method, so it was therefore permissible in terms of fetal tissue donation.
The problem with this tap dance, the law says no changes in the procedures, plural, used to terminate a pregnancy, the actual steps taken, not the procedure as a singular abstract concept. And the Planned Parenthood consent form, it promised the patients that nothing would change in the way they were treated. Planned Parenthood lies to their vulnerable patients, to government officials, and to the public who pays taxes to prop them up. It's time for them to face justice under the law.